The world is rushing to find a vaccine to treat COVID-19, but what happens when it's ready? And how do we make sure it's distributed to the right places in a state large and diverse like Texas? Infectious disease experts tell KXAN political reporter John Engel that Texas is not ready for that next step, and an underutilized state database could be the answer.
The Texas Immunization Registry is mostly used to keep up with vaccinations for children, but experts say it could be a strong tool to target communities with the greatest need for COVID-19 vaccinations once one is ready.
Do you think we're prepared for the logistical challenge that will be that stage?
Not really.
Dr. Melanie Mozoon says the platform has a number of flaws. It requires an opt-in, so participation is low. And records are lost if a child doesn't opt in again when they turn 18.
It doesn't do a very effective job of helping the public health sector decide who to vaccinate, where to prioritize vaccines, what cities might need to be prioritized over others. All of that information is lacking.
State Representative Donna Howard of Austin has been fighting for a reform to the system for more than a decade, but has faced opposition.
There are multiple firewalls within the registry system. The consumers at this point can't even access it. You can't even access your own records. Only certain identified folks that have permission can access it, healthcare providers and that sort of thing.
Advocates say a targeted approach to mass vaccinations could save the state money.
It is really important to help deploy resources and to support our public health officials to better understand and to meet the challenges, to meet the public health need challenges.
The Texas Immunization Registry is free and is available to anyone. John Engel, KXAN News.
We were not able to reach the Texas Department of State Health Services for this story. That agency manages the Immunization Registry. Another effect of the coronavirus, parents not vaccinating their children for other preventable diseases. The Centers for Disease Control and Prevention looked at the number of vaccines ordered by doctors between January, when the first case of COVID was reported, until mid-March, when a national emergency was declared. The number of children getting vaccines dropped dramatically. The CDC worries that people were so concerned about families getting COVID going to the doctor, they put off routine appointments. The fear is that that could lead to outbreaks of other diseases like measles because communities will be more susceptible.